Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Meagan Peeters Gebler, an Appleton-based physical therapist with an extensive background in pelvic health and perinatal care. Meagan holds a doctorate in physical therapy from Marquette University, is a certified strength and conditioning specialist, and has advanced certifications in pelvic health, including pregnancy and postpartum corrective exercise specialist and certified birth healing practitioner. Meagan's passion for health and wellness led her into physical therapy, and now her work is all about helping women understand their bodies, heal with compassion, and build a positive connection between mind and body. When Meagan is not helping women regain strength and confidence, Meagan enjoys triathlon training, running, gardening, and spending time with her family, including her husband, 7-year-old son, and their 2-year-old golden retriever. In our 4 episodes together, we explore numerous hot topics related to pelvic health, as well as how Meagan helps to empower women to understand and work with their bodies for lasting positive change. Let's dive into today's conversation. Hey everybody, welcome back. We are here back with Dr. Meagan Peeters Gebler. Welcome back.
Thanks for having me.
Yeah. In this episode, we're going to be diving into how to heal more fully from birth in less time. And we're going to be talking more about not just the physical aspect, but also the mental and emotional aspect. So I want to start out by kind of highlighting why you're a little bit different than maybe some other PTs that people may have heard about, because you do have some additional certifications and things like that, but you consider yourself a holistic physical therapist. What do you mean by that?
Yeah. So when I think about holistic, I'm thinking about the whole person. So not only just the whole body, but also looking at the state of the person's kind of emotional well-being, the state of their nervous system, life stressors, and kind of the internal and external variables that are contributing to where they're at.
Okay. Yeah, and that makes sense. Like looking internally and externally and not just at the physical symptoms. Because like you said in our first episode, a lot of times when people think of PT, they're just thinking of external force. I have an SI joint pain issue, so I'm going to work on exercises for the muscles around that area, right? But oftentimes there can be internal traumas or things that are being held within the body.
Stressors.
Yeah. And one of the certification that you hold is from the Institute of Birth Healing. And I believe you're the first in the state to have that certification. Is that right?
Correct.
So tell us about what that certification taught you and how you intertwine it into your practice now.
Yeah. So that certification is with a woman named Lynn Schulte. She is out of Colorado. And when I first came across her work, it really kind of lit me up and aligned with all of the things that I've been feeling and kind of knowing in my own way. And so I went through different courses with kind of online clinical knowledge as well as practical exams where kind of learning and demonstrating skills, and then doing some different case studies to let her know that I'm able to integrate her work. And, some of that is prenatal, some of that is postpartum, and then some of that is more in that realm of kind of whole person healing, where it may have extended beyond the physical work and been looking more at something emotional that was impacting or limiting their healing.
So what does that actually look like from an appointment standpoint? Are you kind of bringing in almost like mental health side of talk therapy into your practice, or is this more of like manual manipulation that you're using with your hands as a physical therapist? How do you actually intertwine the mental and emotional piece into what you're actually doing with a patient?
Yeah. So what I find is that, my tool is my hands and kind of my intuition from what I'm feeling. And oftentimes, the gals will also lead the session and let me know. And it's getting curious, right? So feeling a different resistance in tissues, feeling a different tension, feeling a sense of guarding, and just asking them what they're sensing. And if my hands are feeling something in one tissue as compared to the tissue next to it, we're able to identify that there's a difference. And so then through my questioning, it's having them sense into what they're noticing. And it isn't always described with just physical descriptors. It can be hot, it can be cold, it can be dense, it can be angry, it can be tired. And, those words hold value and insight and meaning and can manifest in different ways.
So can you give us, I know you've told us some stories before, can you give us an example of maybe something that happened in your own practice, maybe with a patient? We'd love to hear how this is, how this looks like, what this looks like.
Yeah. So, kind of coming off that one gal that comes to my mind was she gave birth to her son and she was positioned on her back. And that was something that she had really given a lot of intention and communication with her birth team about not wanting to deliver in that position. And despite that, she ended up delivering in that position. And her son, on the way through the vaginal canal, developed some shoulder dystocia and had a difficult delivery and ended up injuring his clavicle. And she had some very resistant pubic symphysis pain. And the left side of her pelvis just was very achy and sore. And despite all of the different things that we were looking at for alignment and flexibility and coordination, just weren't touching it. And, when I went and kind of put my hands on the different parts where she was feeling the pain, and I asked her those kind of leading questions of what she was sensing, it very clearly came out of her mouth that it was anger. Mm. And she shared that she was really angry with her support person. She was really angry with her doula. She was very angry that she was in that position. And she felt as though that position was what led to the complications with her son. And so we worked on some different visualizations combined with my hands being on her body doing myofascial release techniques where she was able to kind of revisualize and reprocess her birth going a different way. And, the body doesn't really know the difference of space and time. So allowing her body to have an experience that was different, that felt safe to her, and kind of on her own terms, in her own speed, she was able to resolve and kind of let go of that holding pattern that she had in those tissues. And she was able to resolve that pain that was persisting and resisting all of the other treatment techniques, and it didn't come back.
Wow. So that could you feel the tension kind of release too while you were going through all that?
Definitely. Wow. Yeah, simultaneously. So I'll be feeling them and sharing some of what I'm feeling, but then also usually they will be kind of giving the play-by-play of what they're experiencing, and it usually is in line.
That's incredible.
Yeah. Wow. That is really neat that you're able to incorporate all of that. Do you help women with this emotional and mental aspect before birth as well? So during pregnancy?
Yeah. I find that a lot of gals who have had their first birth be different than they anticipated, whether it was like an unplanned cesarean or different complications, really find value in kind of reestablishing the trust in their body, reestablishing the coordination, being able to feel into, when they are contracting or relaxing their pelvic floor muscles, is that actually happening? And then by getting the different feedback, they can trust that they're controlling their body or maneuvering their body in a way that is in line. And that insight can be really empowering and definitely change how they go into the next birth with a different level of confidence and awareness.
Sure. Do you feel like, I guess I feel like every woman, when they are pregnant, they are constantly thinking about the birth experience. That 12 to, hopefully less than this, but 12 to 36-hour experience is what they dwell on for like 9 months, and they prepare for, and they think about all the time. So I think that having that mental aspect into your practice is really important. But do you feel like during pregnancy, our stress state can also affect the baby?
100%. Yeah.
How?
Yeah. The way I describe it to my clients is that, what is physiologically circulating in you from a stress hormone respect, but then also from thoughts and feeling is definitely going to be absorbed by your baby. If you are, holding on to different fear or anxiety about the upcoming birth, that's going to change your stress hormones. And that's going to be the bath that your baby is bathing in during that pregnancy. So working on that nervous system regulation during pregnancy can definitely have a positive impact in your baby's overall stress level. And then also, post-birth, that baby is going to come into the world with a different level of stress response and have a different nervous system that can regulate in a different way.
So what does the journey actually look like to work with someone like you? Obviously, you have a lot of benefit that you can bring women during pregnancy and postpartum, but let's just start with what would be the ideal plan if a woman is listening to this and she is trying to conceive or early in pregnancy? When should she start to see someone like you? How many visits would there be prenatally? And then postpartum wise, what do you kind of recommend?
Yeah. So I love connecting with gals during their fertility journey because I feel like there's complexity there, right? There's a different feeling about what their body is doing and not doing. And so being able to establish a friendship with their body that feels supportive and loving can definitely help change that trajectory, and bringing that then into pregnancy the same way. So recognizing more that those symptoms are clues and insights, and that's your body's way of talking with you and asking for help, asking for change, asking for support, can definitely be of benefit. I would say anytime during pregnancy, but typically I like to see gals sometime in their late second trimester, early third trimester, so that we can do an assessment. And if there are things to work on, we still have time and we don't feel a additional stress of a pending birth. But I would say gals that have symptoms during pregnancy, anytime, right? So I guess earlier I'm speaking to the gals that don't necessarily have symptoms present. That can be great to start working in that third trimester, but if there's symptoms, anytime.
Well, you want to make sure that they're, they have some knowledge ahead of time, right? And they have some confidence and they have a connection with you right away. So that's great. I know in the last episode, we talked about breathing quite a bit. And we know how breath is so important, but we want to know, how can breathing play a role in each type of healing, whether that's physically, mentally, emotionally? How does that work?
Yeah. So when I am looking at how breath impacts the body, I like to describe it as I'm looking at the shape of the container. And if the rib cage, for example, is really wide and open and the diaphragm is flat, that is basically a position or a shape of someone who's inhaled. And that feedback from the body, right? So our top-down information from our brain to our body through the vagus nerve is about 20%. 80% is body up. So there's a ton of information coming from the different receptors in the body that are telling our brain and our nervous system about the reality of the state that we're in. So if someone has a wide rib cage, that is telling their nervous system that they're inhaled. Living in an inhale is
Stressed.
sort of dangerous. Yeah. And even if their brain is able to say there isn't a tiger chasing them, their body then says, well, then why are you shaped like you're breathing, like you're being chased? And so we see those kind of mechanical restrictions then impact the nervous system and everything, else that connects to that. But the other piece of that equation is going back to that vagus nerve. If the rib cage isn't moving out to the side, we're not massaging that vagus nerve and regulating that nervous system. We're not supporting the lymphatic system and the GI system and the complexity of how that breath impacts all those other parts.
How would a rib cage get wide in the first place?
So growing a baby is a real good way.
For every woman,
yeah.
typically?
Yes. Yeah. So on occasion, I will see a more narrow rib cage, but that is typically in a gal who's been pretty vigilant and active with maintaining their core, which isn't always the best case because that baby's going to find space and challenge the tissues in other ways. Mm-hmm. So, but most of the time, I do see that rib angle increase during pregnancy.
Okay, so then like you explained, which is super interesting about how that impacts a woman's breath and can lead to almost more of a stressful state just because of how her physical body is shaped at that time. But then how do you help them reshape their ribs?
Yeah, so typically that's something that I like to do on the first visit when I see gals postpartum, is helping correct that rib angle through different hands-on myofascial techniques where I am using the bones of the lower ribs, the diaphragm, but then also like the organs, the liver and the stomach to help restore a more balanced position and shape to that lower part of the container so that the diaphragm can just do its job.
Did I just hear you correctly that you are helping to like actually move organs back in place of where they should be?
Right. Yep.
How do you do that?
Yeah. So visceral manipulation is a technique where it's very gentle and through, again, hands-on techniques, we're able to kind of listen with our hands to both the position and then also the motion of an organ. And we want balance. When something is in the right position, it can move freely and then it can function optimally.
So do you see like results within the first appointment then too?
Yeah. Yep. Yeah. Just this week I had a gal who we changed her rib angle by 18 degrees.
Oh my goodness.
In minutes.
I mean, guys, this is like one appointment that you can get this resolved and you can start moving forward. That's amazing.
And this goes back to our first episode of why we talked about why pelvic PT should just be a part of every woman's care plan, especially if you have a baby, because there have to be, a huge percentage of women walking out around right now with wide ribs because they never knew about it. They've never had it corrected.
They don't understand why this is a problem.
They don't know why they're so stressed out all the time. Well, maybe because you're not getting deep breaths, because you're stuck in a state of inhale, right? I mean, this is like mind-blowing information that every woman needs to hear about. So if you're listening to this right now and you know any woman that's in the childbearing years, make sure that you share this episode with them. But I do want to touch also on one aspect that I feel like may make people a little bit nervous to come and see someone like you as well, though, is that you don't take insurance. Is that correct?
Correct.
But there's strategy behind that as well. So can you share a little bit about that?
Yeah. So when I started Connected Core, I really found myself getting frustrated with the insurance model because they really take the approach of wanting to compartmentalize care and just having you work on the small problem area that they've defined with a code. And, both the whole body, but then also that whole person. It's so much more complicated and it can't be, really honed in on one part. And so you need time and you need the freedom to go where the body leads you. And so that was a real motivator. The other part was access. So oftentimes insurance will define how often and how long you can see someone. And I find that can definitely have a negative impact on someone. So, I have a gal that I see who comes up from Milwaukee and I'm able to see her for 2 hours.
Wow.
Because it makes more sense for her to spend more time with me and not travel. But then I also, have a gal who finds the dry needling to be effective and I'm able to see her for a half an hour every other week. And it just is based upon what the person needs and not what insurance is a third party thinks is best.
Mm-hmm. Mm-hmm. Yeah, no, and I feel like that fits perfectly in with your entire method of just really looking at the person and what they need from every aspect. That's really helpful. And like I said, I think a lot of people are like, I'm not going if they don't have insurance, but there's also like really fresh perspective that professionals that are more outside of the mainstream medical system that they can give. I think I really appreciate your insight into that.
And we had a really good episode with Tabitha too about insurance as well. So that would be also a good one to tune into.
Yeah. Before we wrap up this episode, one more question for you is, do you have any tips for women on what they can do at home to help decrease stress and or just support their healing journey?
I think that probably the best advice I could give is listen to your body with curiosity and not jump to judgment about what you have done or not done, and just being curious about, okay, why might I be feeling that? What is that about? Is it because I'm nervous about something, or is it stressed because I'm about something, or have I been sitting at my desk too long? And, any little ache or pain or symptom really is a clue, and it's your body asking for you to change something.
No,
I like
love that.
I like the curiosity piece, because often you hear, listen to your body, but sometimes we want to force our bodies to do things, or we think that we know best. But curiosity, that's great.
Well, that, and because I think so many of us, we say things to ourselves that we would never say to a friend, like negatively. And so when you have maybe a challenge or a pain point, or even just anything that you are wondering about if it's normal for your body, a lot of times we often go to negativity and judgment.
Or just
and
suck it up, buttercup.
Yeah, that too in today's culture. But if you approach it with curiosity, then it opens a lot of doors.
Yeah, a little awareness, a little curiosity. I love it.
I love that too. If somebody wants to connect with you, what is the best way to do that?
Yeah, so I have a website on there. I have a lot of information. I do have online scheduling as well to make it super convenient for gals. I have limited Facebook access. Otherwise, Motherhood Alliance has all my contact information as well.
And you do mobile as well, so you will come to people's houses.
I do. Yep. Yeah, I would say the majority of my services I do in the clinic, but when someone wants me to come to their home and that's how they're going to be able to start healing, I am happy to make that journey.
Wonderful.
What is your driving radius?
I would say sort of unlimited. I do have just a flat rate for up to 20 miles, and then there's just an additional fee for every 10 miles after that.
Okay, good to know. Thank you so much for being here, Meg, and we can't wait to continue with 2 more episodes with you.
Thank you.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.